Marissa Bird, and I'm going to be demonstrating the reconstitution of powdered medication, drawing medication from a vial, and then the intramuscular, intradermal, and subcutaneous injections, and identifying the 3 sites. Okay, so first I'm going to reconstitute, and I have all of my supplies here in my gloves. I don't have any actual alcohol prep pads, so I'm just using these because they kind of look like them. The powder, the liquid here, the diluent, and then I have a couple of things over here. I have my appropriate syringe, my appropriate needle, and then you would usually use a VAD or a filter needle to mix them or to drop anything, but I did not see one, so I'm just using a bigger gauge needle to do that. Okay, so first I would perform my hand hygiene. This would be a better field. Perform my hand hygiene. I'm going to go ahead and put on my gloves. Okay, next I would uncap both vials. Then I would take an alcohol prep pad. And I would clean both tops here. And I would get a new alcohol prep pad and clean this one as well. Okay, throw that away. I'm going to go ahead and open up all of my supplies. Okay, so I'm going to get my syringe, put my needle on, take off the cap. I'm going to just set that there. Then you're going to pull back as much air as you need. So for the amount of diluent that we need for this powder is 2.5 milliliters. So I'm going to pull the plunger back to 2.5, holding it at eye level. And I'm going to hold this to steady it. And I'm going to come in at a 45 and turn into a 90-degree angle to go straight in. Push the air in. Flip it over and pull it back to 2.5. Flip it back over, slowly take it out. Same thing over here. And put the diluent in, just like that. We would recap our needle by scooping, and then we can secure it that way. I'm going to take off the needle, place the syringe down for now, and then just roll this to mix it. And I said to make sure not to shake it, just roll it. Okay, now our medication is mixed, and you would draw that out and proceed with your injection. So there's that. Now I'm going to go ahead and move on to just drawing from a vial. And so we're just going to reuse this one. So I would perform hand hygiene, put on my gloves, pop off the cap, clean the top, throw that away, open up my supplies, and do the same thing. Put on the VAD or the filter needle. Pull back how much you need. We're going to do just 1 milliliter. Eye level. Come in at 45-degree angle, go into a 90, push in the air, flip it upside down, pull back to 1 Next, you would pull back some air, scoop your needle, now we're going to put on the actual sterile needle for our injection. Put that on, and then you hold it up to eye level and push until the air is out. There we go. Now that one is ready to go for our injection later. Okay, now I'm going to go ahead and draw up for the other injections that we're going to be doing. Well, I'll identify my 3 sites first and then do those as we go. Okay, so for the intradermal, the 3 sites would be like the underside of the forearm, the upper back, or the chest. For subcutaneous, 3 sites would be the upper arm, the abdomen, as long as it's 2 inches from the umbilicus or the belly button, and then the anterior thigh or the top part of your thigh. And then for the intramuscular, 3 sites would be the ventrogluteal, and so you'd place the patient in a side-lying position. You would locate the greater trochanter, the anterior superior iliac spine, and then the iliac crest. So your hand would be like this on the patient's side hip area, and then where you would inject is right in the triangle, right in the middle between your thumb and your forefinger. Next site is vastus lateralis. You would have the patient either supine or sitting down, and this one is on the thigh. You would locate the greater trochanter and the lateral femoral condyle, and then you would place your hand on the thigh like this, and you would imagine a triangle, and the injection site is, I'm sorry, not a triangle, a rectangle, and the injection site is like right in that area. And then the last one is a deltoid. You would expose the arm. You would locate the edge of that Ackerman process, or it's the knob of your shoulder, and then you leave 1 finger there, and then you go down about 2 to 3 fingers, and then that's where you can imagine an upside down triangle, and the injection site is right in the middle of that, so it would be right in the upper arm. Okay, now we can go into our actual injections. I'm going to go ahead and draw up the medications. We already have one drawn up. This will be for our intramuscular. So I'm going to go ahead and draw up for the intradermal and the subcutaneous. Okay, so it would be the same procedures as before. The gloves, the cleaning this, putting the bigger needle on, or the filter needle, the VAD needle, or the VAD, whichever we have available. Open the syringe. We are going to have to use this one. Open that. Okay. For this injection, for an intradermal injection, they're very small amounts, so we're only going to do 0.3 on here. So I'm going to pull my plunger back to 0.3. Same thing, go in, inject the air, pull back to 0.3. Okay, we're going to take this out, pull back for just a little bit of extra water, or air, I mean, recap that, and then put on our sterile needle, push out any air, I'm just going to tap the side because I have an air bubble here. Okay, that one is done. So we're going to get rid of these. Now we're going to draw it for my subcutaneous. The same thing, it would be a new vial. Perform hand hygiene, gloves, clean the top. Opening my equipment. My VAD or my filter needle. Taking it off. Oh, we need to pull back the plunger. So we'll do 1 milliliter. Yeah. We'll do a half a milliliter on this one. Oh, sorry. Push in the air first, then flip upside down. Pull back half of a milliliter. Okay, pull back just a little bit of extra air. Scoop. Also, if you didn't want to scoop, you could place the cap in a medicine cup and do it that way. Just set it in the medicine cup, and then you can stick your needle into the medicine cup that way. Okay, now pushing back up any excess air. Perfect. These are subcutaneous now. Okay, now that we have everything drawn up, I will demonstrate the procedures. So for the intradermal, you would draw up the medication, which we did, select the site, get the patient into the right position, then I'd put on my gloves, which I did, and I've already performed my hand hygiene. Then you would get your site, and you would scrub it, starting in circular motions from the inside going out, not going back over the same place twice. You would wait for that to dry. Then you would uncap your syringe and needle. Maybe. There we go. Okay, now with your dominant hand, you're going to hold this between your fingers like a dart. And with your non-dominant hand, you would hold the skin tight. You're going to come in at about a 5 to 15 degree angle just under the skin until the bevel is covered. And then you can come and steady it with the non-dominant hand. Do not aspirate, and just inject into, okay. It should pull up like a little whelp, maybe about 1 inch. Then you would slowly take this out. You would either recap and then dispose or put it straight into the biohazard. So we will scoop, and there we go. Then you would just draw a little circle around where you injected it, and then monitor it. And then now we'll do the subcutaneous. So at the same start, you select the appropriate needle and syringe, which we also check the gauges to make sure they were the appropriate gauges for everything. You would perform your hand hygiene, draw up your medicine, select your site, perform hand hygiene, or position the patient into the comfortable position, and then you would uncap or scrub the site, which we've already donned our gloves, performed our hand hygiene, and we have our gloves on. And with the same method, going in circles out. You would get your needle, and most of the time for the subcutaneous needles, they have the safety guard on them right here. And then for the subcutaneous, since you want it to go into the fatty tissues, you would squeeze. So I'm squeezing this right here to pull it up. You come in at about a 45 degree angle, but if it's a more obese person, you can come in at a straight 90 because there's more fat there, but we want to make sure we're in a fat. So with your non-dominant hand, you're squeezing. With your dominant hand, holding it like a dart. I use my pinky to steady me here. Yeah, for support right here. And then you would just come in and inject. And then you can use this non-dominant hand to steady the needle. And then you push, inject your medicine. I'm just injecting it kind of slowly in case it's burning. Okay, now you pull it back out. and recap and biodispose. I've also forgot to mention that you also educate the patient as you're doing this. You tell them what they're about to be doing, tell them how big of a stick they can expect to feel, and that type of thing. And then also on these injections, if there's ever any blood, you just blot it off and put a bandage on. Okay, now for the last one, the intramuscular, we have our appropriate syringe and needle. I'm going to perform hand hygiene, put on gloves. I've already drawn up my medication. I'm going to help the patient get into the appropriate position for the site that I'm going to use. So if I was going to do the ventrogluteal, I would have them be on their side. If I was going to do the deltoid, they could be sitting or laying down. That. So same thing, you just get your site, you disinfect starting from in going out, and then they said that you can place the wipe off to the side and have the corner pointing at your site so that you don't lose where it is. Next you would uncap the needle, hold the skin out tight. You're going to tell the patient, because this one is probably going to be a little more uncomfortable since it is like straight in. So then you're going to come at them at a 90-degree angle. You're going to push in. You're going to hold it steady here. You would aspirate first. So just pull back to make sure that you're where you're supposed to be. There should be just an air bubble there. Yep. I'm going to slowly inject the medication. Perfect. Pull it out. Recap. And then dispose of the biohazard. After each of those, you would remove your gloves, perform hand hygiene, ask the patient if they need anything else, how they're feeling, place their call light within reach, and come back to check on them the appropriate amount of time.